Hello, and welcome to another Rosenau Cleaning University, or as we like to say, RCU on the Go presentation. On behalf of the Philip Rosenau Company, I'd like to thank you for taking time out of your schedule to join us for today's presentation, Has Your Building Had Its Flu Shot? We hope you'll find this webinar both informative and inspirational. As you just heard, I hope, you have joined in listen-only mode. I'm Bill McGarvey, the Director of Training and Sustainability at the Philip Rosenau Company. Joining me today is my friend and colleague, John Thomas. John serves as our Sales Manager and Health Rights Specialist. He also brings a background involving international chemical sales, as well as a microbiology degree, and John has also served as a high school chemistry teacher and probably has the scars to prove it. Say good morning, John.
Good morning, and thank you, Bill. With my background, I do enjoy any opportunity to participate in discussions involving science and the importance of cleaning for health, and I appreciate being involved in this program today. And as a former chemistry teacher, let me say this right now and get it out of the way. Yes, all of this material will be covered on the test. Thank you.
Okay, John. So again, we want to welcome everyone to the webinar today, and just want to go through a couple of quick housekeeping slides for those who may not be as well versed in webinars as some other folks. Hopefully you are hearing us, and you can either join through computer audio, or you can also dial in by the phone number that you were provided in the email. As we go through the webinar today, we are asking for questions. We do have a lot of information to cover, so we're not sure how much time we will actually have to address questions during the webinar. However, all questions will be addressed in a follow-up email. John, you want to say a few words about handouts for us?
Yes, Bill, we did include handouts in the handout section of the control panel, and these handouts cover many of the topics that we're going to be discussing. These can be downloaded at your convenience during the presentation.
Okay, so what we're going to cover today, first we want to discuss who is at risk this coming cold and flu season. And actually it's not this coming, technically cold and flu season is upon us. But we're also going to talk about why it covers more than just colds and the flu. We're also going to take a look at the three basic approaches to breaking the chain of infection that will help you to protect yourselves as well as your customers. And then we'll take a look at some of the latest innovations in disinfection technology that can give you the added edge to deal with any outbreaks you may suffer within your facility, or better yet, to prevent them from happening.
By participating in today's webinar, we're following the advice of that most famous of Philadelphians, Benjamin Franklin. And in this particular case, we're being prepared means understanding the nature of the threat, the challenges that we are going to face, and methods to use to overcome them. To start with, we wanted to talk about these challenges and in specifics, what are some of these public enemies that we need to deal with. Public enemy number one, influenza. We've listed there some of the characteristics of influenza. Many of these we're well familiar with. I did want to point out that this year is the 100th anniversary of the influenza pandemic of 1918. That outbreak or that pandemic is considered to be one of the worst healthcare catastrophes to ever befall mankind. During that 2-year period, 675,000 Americans died due to influenza-related illnesses. And it's estimated that over 20 million people worldwide succumbed. This explains why back in 2009, when we had an outbreak of H1N1, which is the same strain as the 1918 pandemic, created a tremendous amount of concerns within the healthcare community. Fortunately, no pandemics did develop from that, as were potentially feared. Public enemy number two, the common cold. Mostly we know this basically as an irritant since we do mostly recover from these cold infections. As noted there's many causes, many viruses are involved with creating these types of respiratory infections. Most commonly, it's rhinovirus. You got to love the name rhinovirus. But rhinovirus, as well as most of the other common cold viruses, are non-enveloped viruses. And we may ask ourselves why that's important. Well, non-enveloped viruses are the most difficult viruses to kill, and they're very resistant to environmental challenges. And lastly, as Bill said in the opening, it's more than just cold and flu, and so we included in this program norovirus, which causes severe gastroenteritis, or as we lovingly know as the stomach flu. That name actually is appropriate in that norovirus outbreaks follow closely to the cold and flu season. Norovirus in particular, extremely contagious, but also as a non-enveloped virus, it is very difficult to kill and can last in the environment for much longer than even what's listed there at 7 days. So again, something that needs to be considered when we're just making our disinfectant selection decisions. Now, we've all had this past summer to forget. We've enjoyed our days at the beach or in the mountains or wherever else we like to spend our leisure time. But let's take a look at last year's flu season and see what we can learn from it. The CDC did rate last year's as a severe flu event. And for severe, one of the characteristics of that is that they have a high impact on children and young adults, typically not populations severely affected. So it's something to be considered for the educators in our audience. This is similar to the 2009 H1N1 outbreaks that also had high attack rates on college students. And there were, from the news, which affected local colleges in the greater Philadelphia area. There's some other oft-quoted facts here regarding the amount of school days lost, 22 million for common colds and 38 million lost to the flu. It's interesting to note that there's 20 million people get sick with norovirus each year, and that actually has a severe impact on the economy of upwards of $2 billion due to lost productivity and healthcare costs. We're going to say a little more about norovirus because our customers do ask us a lot about this question. Norovirus is associated with being that cruise ship virus. And actually, at a study by the CDC, we see that it's actually more of an institutional type of threat, and that is long-term care, continuing care, other healthcare related facilities, as well as food service and education type of operations. So again, the cruise ship, it kind of gets the bad name with it, but I do think that that points out the infectiousness of this particular virus, because it only takes a few people entering the cruise ship. Typically it starts with a food or waterborne transmission and then goes to direct contact between individuals, as well as indirect contact through individuals and environmental surfaces. With regards to a norovirus outbreak, and as basically any type of viral outbreak, our responses do obviously focus on the care of the individual. However, for all of us here this morning, we're really talking more about then taking care of that environment. With regards to norovirus, as I said earlier, being a non-enveloped, it survives a long time in the environment. It is fairly difficult to kill, and for norovirus in particular, it has a very low infectious dose. Less than 100 virus particles exposure can lead to the illness. The illness involves severe vomiting and diarrhea. So, dealing with these types of cleanups requires staff training on your part, our part, with regards to how to handle this in a safe manner. And as I depicted here, this involves using, body fluid spill kits so that people have the proper protection and the proper materials. Bill, did you want to say something about that?
Yes, John, thank you. It is a requirement that all of our employees receive annual bloodborne pathogen training so that they are aware of some of the risks associated with cleaning up blood and other body fluids. And while oftentimes fecal matter, urine, vomit is not, in the eyes of OSHA, is not considered a bloodborne pathogen, one of the terms that we've seen arise recently is OPIM, which stands for other potentially infectious material. And that's certainly what we're dealing with in this case. So it's also about the protection of the person that's involved in the cleanup of any issues surrounding that illness.
Okay, so now we've discussed a little bit about the threats that we're going to face. So the question is what do we do about it? And so there we look to the healthcare industry, where their business actually is the control of infections. And they've come up with this term, breaking the chain of infection, which is really what we're all about in terms of providing that healthy, safe environment, is breaking that chain. So what we want to first focus on then are what are the approaches, and there's three basic approaches that we look to here from Philip Rosenthal to take care of this issue. Number one is the prevention activities. Those are those activities that we do up front to help individuals protect themselves. And then we move on to routine activities, which are those that we do on a daily or regular basis to reduce exposure to these types of pathogens. And lastly, then, what can we do periodically that provides that extra insurance, that extra effort when needed to further protect our customers from the pathogens that we've just discussed, especially during outbreaks and times and areas of heightened concern. From a prevention standpoint, hand hygiene is where it all starts. In fact, WHO, the World Health Organization, lists as a key factor in controlling the spread of infectious diseases is an effective hand hygiene program. So what we want to do is take a few minutes now to take a look at the key components of what does make up an effective hand hygiene program. It all starts with a high-quality hand soap. Now, we recognize that we all have economic and other considerations when making decisions for our facilities, but from an infection prevention standpoint, we want to provide a product that encourages hand washing as much as possible. So is it a pleasant fragrance? Is it easy on the skin? Several considerations go into, again, we want to encourage hand washing as much as possible. In lieu of hand washing, where it's not practical, the CDC does recognize that alcohol hand sanitizer can be used. And the specification is when the hands aren't visibly soiled. The key thing with alcohol hand sanitizer is that it should have, and you should check with your manufacturer, but it should have a minimum of 60% alcohol to be effective for this application. So we've decided on our hand soap and our hand sanitizer. How do we dispense the product and where? So are dispensers located in convenient locations? Going back to that initial statement that we're trying to prevent infections, we want to encourage the use of either hand sanitizer or hand soap. Conveniently locating these dispensers throughout the facility should be a goal. Including with hand hygiene is this concept of cough etiquette. We heard a lot about that last year during the flu season, coughing into your elbow, doing the elbow bumps. It is, again, studies have been done, and the most effective way of controlling the aerosols that come out during a sneeze is through the use of a facial tissue. So we recognize, just as before, that there are economic considerations for any decision that we make, but if we want to try to reduce the spread of some of these respiratory illnesses, controlling these aerosols is an important component. So again, where possible, practical, it's a suggestion that has to be made. All this centers around education, and this goes from both children, as we know, they learn how to wash their hands, singing the happy birthday song, all the way up to adults. And we know this when we go into a restaurant, into their restroom, there's that ever-present admonition that every healthcare worker or food service worker needs to wash their hands. And again, knowing that most of these diseases are hand to mouth, we wholeheartedly hope that they follow that guidance. And lastly, we want to just talk about the concept of paper towels versus hand dryers. Much debate about this, and as with all these other considerations, we know that there is an economic and facility-specific consideration when making this decision, but the fact is most people prefer using paper hand towels when washing their hands. So if the idea is to encourage hand washing, providing paper towel is one of the facets for that. So we think that it should be a consideration when you're looking at your overall hand hygiene program. We talked about the dispenser locations, and the purpose of this slide here is just to graphically show the information that's available from the manufacturers. It ties into education, but also where are those dispenser placements that make the most sense? And so, as shown here, they've obviously identified locations for hand sanitizer as well as various other products. But again, the idea being, how do you get the most dollars for that hand care investment? This can even go down into specific recommendations, such as where do you put the hand sanitizer dispenser in a restroom to get the most use? These manufacturers have spent significant sums of money studying this, and trust me, there are people that study restroom behavior, and by studying that, they find ways to modify that behavior to get the maximum in compliance. So they've come up with some of the specifications that you see here on the slide, and then looking at this graphic, you can see that these specifications were followed in the placement of this hand sanitizer dispenser at the exit door. I think the one thing I looking at this picture is, and I think I speak for all of us, I would be comfortable using this restroom, which again is the key thing with encouraging proper use. It also speaks to the importance of perception. We all know that we judge restaurants based upon the appearance of their restrooms, and we also know that people judge us for our facilities based upon the appearance of restrooms. So appearance goes a long way in terms of providing that healthy environment. We're going to
let's just do it. Roll with it. Go back.
We're going to take a moment. We have a brief technical difficulty.
Please stand by for a second.
Thank you. At this point, Bill's going to run a quick poll. When I was a chemistry teacher, we knew these lovingly as pop quizzes. So this poll is going to ask, what percentage do you think students use soap after going to the bathroom?
Okay, so we'll give everyone a second to please log in on that and weigh in your guess as to what percentage of students use soap after going to the bathroom. And we see some responses coming in. We'll give it just another moment here. Okay, it looks like most folks have weighed in, so we'll close the poll and I will share the results. The vast majority, or large majority, we think it's only 18%. And the answer is
18%. So, and I feel pretty good that actually 53% try to do something, and I guess that's one advantage of the paper towels, hopefully, that are in that bathroom. 18% doesn't give me a lot of confidence if these people might actually be handling my food at some point later in the day. So let's take a quick review then of these key hand hygiene components. And we suggest that these be reviewed on a regular basis to make sure that you're meeting the current needs of your facility. The product. And we basically don't expect that anybody's using bar soap out there, but are still using bulk soap. Maybe a consideration there. Dispensers. Again, are they convenient and easy to use? People like convenience and ease of use as part of their decision-making process. So taking a look at that. Cough etiquette. There's many ways and educational efforts ongoing with that, but one key component of it is to actually provide those paper products. And lastly, do you have ongoing educational efforts to promote the use of hand hygiene throughout your facility? In healthcare, this is a major effort to get compliance. So I'm sure this will be then appropriate for all facilities. In the materials in the handout section, there actually is another sample of lesson plan that could be used in education for this type of program. So what's it look like out there in the real world? In this particular case, this is actually a live photo or a photo from an Atlantic City casino. We're not sure if this is a statement as to what the custodians felt about the hand dryer, whether it was out of commission, obviously, but it didn't give a nice overall impression in terms of the facility. So obviously something we would hope not to see with our customers. This is another real-life photo taken in a medical office building. On the left, you see what we would recommend as a proper dispenser placement. Apparently, they made a decision regarding their bulk soap dispenser, but putting a pump top bottle on top of it, as my granddaughter would say, that was very awkward, and I think it speaks to not encouraging use in a medical office building. That would create some concerns for me. And then we have this view of a proper placement for going into this breakfast or break area. Good impression in terms of what the facility thinks is important. And as we've said before, it encourages use, as opposed to the elevator lobby where they had a bulk hand sanitizer dispenser. I'm not so sure about bulk hand sanitizer, but also they couldn't hang the dispenser straight on the wall, so I'm not so sure I would trust what they're actually putting into it. So we've talked about hand hygiene as being where it starts for prevention. When it comes to breaking the chain of infection, where it finishes is with vaccination. In this particular case, we're talking about the flu shot. And we thought it was important enough that we actually included it into the title of our program. Very simple. It changes from year to year. We know that they select the influenza strains that they think are going to cause the most problem. You need to get it every year. And I hear many opinions about whether or not somebody should get the flu shot and even vaccinations in general. Simply stated, vaccination has saved more lives than any other single medical development in the history of man. Okay, so now we're going to run a poll to see if this is something important in your facility. In healthcare, there's active programs involved with getting people immunized.
So here's our second poll, folks. Does your facility have a proactive program for encouraging annual flu vaccinations, yes or no? I'm assuming for our folks in healthcare, you're already checking a yes because it's a requirement. I know that some of the facilities, we're required to have our flu shots before we're allowed in the front door. So I'm just curious to see how many institutions that are on the webinar today do actually promote this. All right, looks like we have everyone has weighed in, and now we'll share that result. Looks like the vast majority of facilities do, in fact, promote vaccines.
Okay, and to close, we're going to have Some words from our favorite Philadelphian. Ben Franklin was an ardent supporter of a process called inoculation, which was a precursor to what we now know as vaccination. And up until the day he died, as you may remember from your science classes, vaccination was introduced in 1796, just a few years after Ben passed away. But here it is 280 years later, and we're still seem to be having that same argument as to whether or not I should get vaccinated. Well, if Ben was on this program here today, he would say, heck yes. So please get your flu shot. At that point, or this point, I'd like to talk to Bill here and get benefit of his extensive background in the application of sound cleaning practices, something he's doing on a regular basis, and he'll bring us up to date with that second approach to breaking the chain of infection, routine activities.
Well, thank you, John. In keeping with the tenor of our program, we've got another quote here from Ben Franklin. I'm going to paraphrase it, though, and update it. He says, well done is better than well said. I think in today's age, well documented is better than well said. Certainly, I think it's important that we have our procedures in writing, that we've documented training, that our frontline workers have been thoroughly trained in the proper ways to routinely disinfect the areas that we're responsible for. Before we get too far into the routine, I want to take a moment and just talk about what is the difference between cleaning, sanitizing, and disinfecting. All too often, we hear these terms used almost interchangeably, and there is a definite difference between each of the three. And that's shown in the example of the slide here, where we've got the various reduction percentages in germs, anywhere from 99 to 99.999. And we might not think that those additional nines to the right of the decimal point are that important. But when we consider the exponential growth rate of germs, those extra nines do actually add up. Germs reproduce under ideal conditions. They double about every 20 minutes. So one germ could potentially grow to nearly 64 billion in just over 12 hours. That's why we use our disinfectants every day, folks. Again, we're talking about breaking the chain. We've got to reset the counter. Do we knock that all the way back to zero? Probably not. But by resetting the counter, it slows that. We've interrupted that germ growth. Another thing I'd like to talk about for just a minute is that definition of routine. Now, I looked this up on dictionary.com because it's hard to find a copy of Webster's anymore. But the first couple of definitions there, I think, are pretty commonplace, and we're familiar with it. What really caught my eye was definition 3. Regular, unvarying, habitual, or unimaginative. I can't help but think about how often we end up behind the 8 ball because someone, a frontline worker who has not been properly trained or adequately trained, tries to come up with a better way. They try to build a better mousetrap, and often it's well intended, but the results are often far from what we were hoping for. So looking at routine cleaning removes germs and oftentimes, more importantly, the nutrients that they require to survive. They also reduce, as we see with our statistics here, a reduction in the chance of catching the cold, reduction in surface contamination, ultimately, hopefully, if we're doing it right, resulting in a large reduction in absenteeism. And absenteeism costs the average employer $861 per employee per year. And that's based on a study that was done in Europe a few years back, but was exemplified in a white paper from ISSA on the value of clean. So think about that $861. If you're in primary education, we don't really associate that number with the students being out sick, but every time a teacher's out sick, we have to hire a substitute. That's an additional impact to the budget. So looking at routine disinfection, historically, where have we used disinfectants? Well, on restroom surfaces and certainly within patient areas, in healthcare and long-term care. But we have a new normal. John mentioned the H1N1 outbreak of 2009, and that got us looking at schools and public spaces differently. We've got a listing of some frequently touched points, or the term high touch points is used a lot of times with these items here. But when I asked a group of people to give me a list of high touch points, someone said, well, do you mean the lights? And that wasn't really what we were talking about. It's frequency of how often these surfaces are touched. John, did you have something you wanted to say here?
No, I think this points out, again, Bill, as you've seen in your training, but routinely in schools talking about infection prevention and cleaning for health, which is something that probably didn't happen much over 10 years ago.
Sure. More than likely it didn't. It wasn't really something we focused on. We tend to focus more on the floors, which brings us to the next topic. Is there's an ongoing debate as to the effectiveness of actually disinfecting floors. But just this morning, I saw an article on LinkedIn that came from CleanLink, which ultimately I believe was Sanitary Maintenance or one of the trade magazines, where they were talking about the fact that in healthcare that disinfecting the floors is becoming more commonplace because the wheelchairs that come in from outside, the gurneys that come into the ER from who knows what scene when the people were being transported to the ER. And just walking around, we tend to pick up a lot of things. Think about those of us that have a shoelace that comes untied. Where was that shoelace dragging just before we noticed it? And then how do we fix that situation? We reach down with our hands and retie the shoe. So I think there may be some validity to spending a little more time and really looking at, should we be disinfecting these floors? Obviously that brings into some considerations. What floor coatings do you have, and matching the disinfectant to the floor coating so that we're not undoing someone else's work. So how are we doing? Now I asked John for a scoreboard slide for this piece of the talk, and John, knowing that I'm an Eagles fan, couldn't resist but to put up our Super Bowl 52 score. So our apologies to any Patriots fans out there, but we really do need to see how we are doing. And one of the challenges with disinfection is we're dealing with an invisible enemy oftentimes. So there's a professor out at Arizona University, Dr. Charles Gerba, and he's been doing germ count studies for a number of years with a number of his students. A while back, they came out with a study where they looked at office desks, office telephones, and toilet seats. And the results of their study came back, and they basically found that the desks and the telephones had in excess of 20,000 germs per square inch, whereas the toilet seat had 49 germs per square inch. And if we think about that, that's because we tend to use our disinfectants daily, hopefully appropriately, but we use them daily, and our customers will do everything in their power not to touch our toilet seats with their bare hands. When the study came out, they suggested that it would be safer to eat your lunch off the toilet seat than at your desk. I personally have not tried that yet, and if anyone has, feel free to share that with me. In another study recently in airports, they found that the security bins, where you go through the security checkpoints, those bins, more than half of them tested positive for influenza and rhinovirus, whereas the restrooms, and we all have horror stories to tell about airport restrooms, but none of those germs were found in the restrooms of those same airports. So I think that's interesting that where we have been using our disinfectants, we tend to score much better. But there are limitations to disinfection, and we want to tend to follow the label. We want to understand, what is the dwell time for the product? Just the other day, I was at a customer location. We were talking about their disinfectant, and I asked the question, how long does that disinfectant take to kill the germs it's supposed to kill? I was shocked by the answer, to be perfectly honest with you. But even in this day and age, folks don't understand that. And a lot of us grew up watching the 409 commercials on TV, and we think things are a spray and wipe. When we talk about disinfection, that is rarely the case. We also need to look at dilution. Are we properly diluting the product? More doesn't make it kill better. Less, it doesn't kill the way it's supposed to. So we really need to have the appropriate concentration of those active agents if we're going to get the effective kill that we want. Which brings us to the next piece of the puzzle, efficacy. What germs are your disinfectants effective against? Each disinfectant has to have a list of what germs and fungus and bacteria and viruses that it is effective against. We need to make sure that the one you're using matches up with the organisms with which we have a concern. And lastly, what surfaces are we trying to clean or disinfect rather? We don't want to be causing damage to the surface because we all know what happens in those occasions. So, and I think John has got a...
Yes, I think it's time for another pop quiz here, and we won't be grading on this one either, but we are interested in what, in your facility, what's the typical dwell time for the disinfectant or disinfectants that you have chosen? So, appreciate.
Got some results coming in
And
here.
these are very reasonable results. So, I think we've got everybody accounted for. So
that's interesting. We've got a few folks at 2 minutes, 5 minutes, and 10 minutes. Now, it really does depend upon the disinfectant that you're using within your facility, but generally speaking, it is a 10-minute dwell time, and that means that the disinfectant needs to be on that surface, needs to remain wet for 10 minutes to truly be effective against all the organisms that are listed against it. There are some newer disinfectants out there that have a quicker kill claim, so some of you may be correct with your 5 minutes. And there are a few things out there that may do it in 2 minutes, depending on the organism that we're talking about.
No, that's a good summary, Bill. The key connection is between the organism that's on the label and what that specific efficacy is.
Okay, so, and the label on your product should show that efficacy information for you and the active ingredients within it. And this shows you sort of a close-up on the particular label we have on the slide there, where it shows you the areas of use. It also shows you what it is effective against. And if it's not on the label, that information should be available through the manufacturer. So,
and there is a little bit of an exception to that. There are times when we have novel, especially viruses that are introduced, that there is no efficacy for any product has been done. And so what the CDC recommends is that you use norovirus, as it is that non-envelope, difficult to kill virus. And if the product's effective against norovirus, then that should be good for whatever you're concerned about. The examples that come to mind was when we had the Ebola scare. Read all the product labels you want. Nobody's testing their disinfectants against Ebola, but it's a fairly easy to kill virus, and hence they said use norovirus. There was also some enteroviruses a few years ago. The same criteria is used.
Thanks, John. And this just shows you the backside of this same container where we have approved uses, applications, proper dilutions. And again, we blew this up a little bit for you here. Almost, I believe every disinfectant starts out the first line of those directions for use. It is a violation of federal law to use this product in a manner inconsistent with its labeling. Again, our disinfectants are regulated by the Environmental Protection Agency under FIFRA, the Federal Insecticide, Fungicide, Rodenticide Act. So we need to be properly diluting these, using them appropriately. Oftentimes, a healthcare institution will find themselves in trouble with Joint Commission because they can't show where they're leaving the disinfectant on the surfaces for 10 minutes to truly kill the organisms that we're targeting. So that is always a consideration. And this brings us to the little discussion on microfiber. The effectiveness of microfiber has been shown. Microfiber by itself with plain water can remove up to 99% of the germs on a surface. We've also got a term there, quat binding, something that happens with our traditional wipers, the cotton cloths, if you will. If we're walking around with a container of disinfectant with a rag soaking in that, if it's a traditional cotton rag, one of the phenomenon that occurs is called clot binding. And it's basically where the active ingredients of the disinfectant attach themselves to the fibers of the cotton rag, thereby reducing the efficacy of that product. And it doesn't take a long time. Usually within about 10 to 15 minutes, we can see a drastic reduction in the active ingredients. With microfiber, that's less of an issue, but it is something to be concerned with as you're trying to disinfect.
And Bill, that's one thing, we talked about those disinfectants earlier with the dwell times, those new technology accelerated hydrogen peroxide type of products. One thing that they avoid being hydrogen peroxide as the active ingredient. They do avoid this concept of clot binding.
Okay, great. A couple of other nice things with with microfiber is we can help to avoid cross-contamination when we have a color-coded program with our microfiber. So there's someone, if red is our color, typically in healthcare, red is for isolation areas or high probability areas of infection. So they'll use red for those areas. So they see someone out in the hall wiping down a water fountain, that might be a red flag, no pun intended. The other thing with microfibers is there's reduced chemical and water use. Because the cloth is so effective in and of itself, we tend to use less product to actually achieve the same or better results. A couple of things to be considered are laundry. Do you have laundry facilities, laundry capability within your facility, or is it something we need to look at? Recently, we partnered with an organization that really is keyed more for Center City, Philadelphia, but they pick up the microfiber, take them back, launder them, and return them to the facility, and they do this using bicycles. So it addresses a sustainability part of the equation as well. Cost considerations can be somewhat off-putting initially because to start up, you need to have cloths or microfiber that are in use, some that are in the laundry, and some that are ready to be used. So ramping up can cause some angst around the budget. But when we start to look at it's really an investment in the long-term improvement of how we clean and disinfect the facility. Another poll for us, John?
Yes, we'd like to better understand, our customers in terms of what they're looking at. So we have a poll here with regards to your participation in microfiber. Is your facility currently using it, and at what level? So we would appreciate responses there.
All right.
Okay, I think we can share that information. It's looks like
the majority of folks are using wipers and flat mops. Some folks just wipers, and some are not currently using microfiber. So I would encourage you, if you have questions about microfiber, please reach out to your Philip Rosenau sales leader. Contact John or myself. We'd be more than happy to help navigate that maze with you. So how do we get it right all the time? And that's really key for us. We can't. This is not an event. Oh, sorry, let's get rid of that poll there. It's not an event. This is something we need to do consistently, day in, day out. We've got to get it right. Yes, we have to get it right all the time. So it starts with proper products and procedures. You need to understand what the efficacy is, what the dwell time is of the products you're using. Your procedures need to be in writing. And then we can look at consistent training and third-party certification for your training to make sure that your frontline folks know what they're supposed to be doing and what are the limitations of what they're trying to do and how can they best protect themselves. Because we all know they're key in breaking this chain of infection that we've been talking about, but they can't do that when they're home in bed sick as well. So we need to make sure we're protecting them. It also requires management involvement and follow-up. I'm sorry, folks, but that's the nature of the beast. Our supervisors and managers have got to be as close to experts in this as they can be, and they need to make sure that these things are being addressed and addressed properly. And then finally, some cleaning process monitoring and or validation. ATP, which is short for adenosine triphosphate. This is something that does not give us germ counts, but it does give us an indication of the organic soil load on a surface. So we can draw some correlations that if we've drastically reduced the organic soil, that we've reduced the germs as well. Some of the UV gels and markers that are available out there, we can mark a surface and then come back after the cleaning process with a black light and see, was it removed? And this isn't meant to be an enforcement on our frontline workers. This is more of a training aid so that we can get folks to understand how important their work is and how important it is that they get it right every time. So with that, John, I'm going to hand it over to you, if you will, and take us through some of the periodic approaches, if you would.
Well, in the past, from a disinfection standpoint, there really hasn't been anything available that we could do on a periodic basis. It was really what you were doing every day, and then hopefully if you had a good preventative action program in place. But now, and it is a testament to everybody on this webinar today, in that we are looking for ways to take the latest in technology that have been developed that can help us achieve these safer environments, which can be applied on a periodic basis. And this is all being driven by this increased focus on controlling outbreaks. In the past, people just got sick and the organization just rolled along with it. Well, now, when you have colleges being closed because of norovirus, you have, we just saw it this year, with the start of the school year, the classes that were being suspended because of mold. If you go into visit a loved one in a long-term care facility, you'll see many times that there's regarding possible quarantine, or they're concerned about influenza in the facility. They ask you some of your behaviors, and then we all know with the high absenteeism and the impact that has, and we in our industry are being asked to be able to address these issues. And I like to think about back during the period of H1N1 in 2009, I was watching the news report, and there was a school that had shut down because of the flu. And of course, the TV crews show up, and they're taking pictures through the plate glass windows, and people are in there with buckets wiping walls. And they caught some poor custodian trying to go home and wanted to know what was going on. And he said, "Don't worry about it. We're in there wiping everything down with bleach." And I'm thinking, okay, it's the new millennium, but if we have an outbreak, the answer is let's clean like it's 1950. So there has to be some better ways out there, and there is technology available now to help us address these issues. And this is this need to get these, as Bill said, frequently touched, which is a much more apt phrase, but all these frequently touched surfaces throughout, with our customers. Obviously, healthcare is always concerned about this, especially with their efforts to reduce healthcare acquired infections. But I had a customer of ours, they're a primary care deliverer in an urban setting, and during the Ebola scare a few years ago, he called me and asked, what was he supposed to do if there was somebody that came in, waited in the waiting room, went through the ER, went to radiology, and then was eventually admitted that they actually found out had Ebola. And I said, well, hopefully you wouldn't be calling me now to help address this. These are the types of things that we need to be thinking about and have some plans in place to help address these issues. So in education, what starts in healthcare now is quickly going to the other market segments. As we have talked about all along, they're trying to control outbreaks. Some of their things have to do with mold. Also MRSA with our sports teams. So there's things that they're being asked to address, and of course it falls to environmental services, custodial services to have the answers.
John, real quick on that, when we talk about education, also norovirus is a concern for, especially in higher ed, where we have a lot of late teens, early 20s living in close proximity to each other, right?
That's absolutely. And so how do we do that entire campus in a quick, efficient manner? And then public buildings. Many times they weren't even worried about disinfecting in the workspaces. Well, today We have shared workspaces. People are coming into offices once a week, and they're using a workspace for a day or two, and then the next day it's a totally different person. And I always think about the fact that people ask me, they want to disinfect my phone. I said, I don't really care about the germs on my phone. They're my friends. They've been with me all my life. It's the germs on your phone that scare the heck out of me. So we have many of our customers now are looking, how do we take care of these types of community areas that need to be disinfected?
Some facilities, John, even have flex workspace where people move around. They don't have an assigned desk. They go wherever they feel like working in that particular time of day, really.
Oh.
So that really compounds the concern there, right?
Makes it like a school. So what is this solution? And many of you may have heard this now, but the use of electrostatic spray technology as a general area, we call it no-touch disinfection, but it does meet that need for improved disinfectant application. We're not going to go too much into the technology of it, but basically you're just, imparting an electrical charge onto the disinfectant particles that comes out of the spray gun or device, and then that charge allows it to have a high attraction to surfaces, which is really where we want it to go. And so from that standpoint, we could take a look at both the evolution of disinfection in terms of application, as well as the options available. We all are familiar with using manual wipes to apply disinfectant. Many times we've moved that up to using a spray bottle or spray canister. Both of those fairly labor-intensive, chemical-intensive. Some people have tried foggers. The problem with foggers is that they're designed to put, to take care of the air as opposed to the surface, and that's where electrostatic application comes in. We've depicted two devices there that we support, the Clorox Total 360, as well as the Victory Innovations handheld sprayers. So they are designed to make sure that that product comes out of the sprayer and it immediately attaches itself to the surface. So it eliminates that manual wiping. It minimizes chemical use. Again, it's increased productivity. You can do a large amount of areas very quickly, and then allows those areas to be reoccupied. All this results in better outcomes, but it also involves better perceptions. So again, we're all working for perceptions in terms of people feeling that we're doing everything that we can to take care of that. At this point, we'd like to take a quick break and show a video which shows disinfection
real world.
The real world.
The school district that we had last year actually utilized no-touch disinfection.
Is everywhere, and now one local school is taking extreme measures to keep children safe. Our Don Timoney is at Northampton County High School, where the school is turning now to technology.
You could call the maintenance crews in the Northampton County School District germ busters these days. They're now using fog machines with hospital-grade disinfectant to stay ahead of the flu outbreak, the worst in nearly a decade.
The first applicator he's using is a more aggressive surface type cleaner. It's used more to treat the tables, door handles, any areas, any touchable surfaces.
While the district is doing its usual classroom cleanings as well as extra wipe downs, the fog machines kick the cleaning and disinfecting up a notch.
It is an electrostatic sprayer. It makes the particles that come out of that stick to any surface.
Nothing's ever 100%, but we're told it's 99.9% effective in killing the bacteria.
The Lehigh Valley Medical Center in Allentown has been so inundated with flu cases, it set up tents to handle the surge. With 5,500 students in its 6 schools, the district is not taking any chances. It has 2 portable fog machines and a plug-in version, which has a broader, finer spray to cover the entire room.
Our second and third shift crews are going to go through nightly and hit each building after the kids are done, making sure we cover all the classrooms, offices, especially like the nurses' areas. We'll hit them extra hard.
Superintendent Joseph Kowalczyk says they've only been using the fog machines for several weeks now, and they seem to be making a difference.
Our attendance rate has been pretty steady. We haven't seen an excess in students being absent or staff, but we're trying to stay ahead of the curve.
And so far, so good. Officials stress the spray is not harmful, and the fog machines are used before students and staff come in for the day and after they go home.
I spoke with the school actually just recently, and they've already started using the program for this year. In particular, they were looking at some areas where a student had pneumonia, and as well as ringworm, which is a fungal infection. So, we're glad to report that. And also, it's always nice when our custodians and housekeepers and environmental services are shown in a positive light, doing something positive in a community. I'm sure everybody in the school district felt good seeing that report.
That was good to see for a change, that we were actually able to impact something in a positive light. We tried to get some information regarding the actual absenteeism figures, but school nurses tend to guard that information like gold in Fort Knox. So we were unable to get any actual numbers for you on that, but it was interesting that they felt so good about it, they actually had Fox News come up on it. So John, if I'm hearing you right, some of the things we need to consider with regard to no-touch disinfection, we want to make sure it has a low toxicity with minimum PPE requirements for the operators. Not so, we want it to be effective, which is our second little bubble there. It's got to be effective against the organisms that we want to target with appropriate or realistic dwell times, something that we can truly achieve. And then we want it to be safe on most, if not all, surfaces, because it does us no good to have killed the germ, but in essence, if we humanize it, we've taken care of the symptom, but we killed the patient. So we can't have that either. So just to summarize, in-service training is key. Obviously, these types of equipment, the frontline workers need to understand what they're doing with it, what the dwell times are, what personal protective equipment they should be wearing while they're working with this, and how to do it appropriately. And we need to remember that it does not replace our effective daily cleaning or disinfection, our routine work. So John, why don't you take the last couple minutes here and briefly tell us about what is new in the periodic disinfection world. So
there are being things introduced that are novel. They're using nanotechnology to develop antimicrobial films and coatings that can provide some residual antibacterial, antimicrobial type of effectiveness. They're looking at self-cleaning surfaces, and there's some products out now, again, through oxidizing type of actions to be cleaning themselves. Another aspect of no-touch disinfection is the use of UV light. This is being used in a lot of hospitals now, where they're using very powerful UV light in areas where they need high-level disinfection, something that we really don't need outside of an acute care setting, but that's still there, which has led to smaller systems. And if we know everybody's got a tablet or an iPad or a PC and a smartphone, and so ways to disinfect these using UV light obviously don't harm the devices themselves, but are effective at reducing organisms. Which brings us to the point of, at the end of the program, where do we go from here, Bill?
Well, John, as we started out saying, now is the time to prepare. If you wait until you have the outbreak, the cat is literally out of the bag at that point. So through prevention, again, what is your hand hygiene program? Can we help you out with that? How is it being promoted throughout your facility? It's time to get that flu vaccine. If you haven't done it, you should. If you had it as recently as May or June, that was last year's vaccine. You need a new one. Health and wellness, we have a tab on our website. John and his team have done a tremendous job of pulling together a wealth of information. Highly encourage you to go to our website, click on that health and wellness tab. John has a ton of support information there. For our routine cleaning, and disinfection, let's make sure we know the process, we follow it. Certainly, a number of you out there are familiar with the RCU classes. Some of you will actually be in attendance tomorrow when we start the fall series. Looking forward to seeing you. And we'll be posting more videos on the RCU on the Go tab to really follow up with this and give some more insight into how we can routinely do the right thing. I'd encourage you to take a look at the spray bottle sensibilities video that's already up there, which talks about how to properly use spray bottles. And then periodically investigate the possible opportunity for no-touch disinfection. It's best to be prepared ahead of time, again, not after the fact. And please, consult with your Philip Rosenau sales leader to help develop a plan. We are here to assist you in preventing an outbreak within your facility and helping you to keep your customers safe and healthy. So we are out of time today. If we have any questions, we will be addressing those. And we will be posting a webinar survey will be coming up shortly once we conclude the broadcast here. Again, a follow-up email will be coming out with questions addressed. The webinar will be up on our website hopefully within the next few days if you have other folks within your facility who think could benefit from it. Again, we thank you for the time today. John, any closing words?
Clean for health. Thank you very much.
All right. So while you're cleaning for health, let's get it clean, but safely. Thanks again for joining us today.